Hi everyone, hearty welcome to our YouTube channel. This YouTube channel is for you. Very useful information, management concept, standards and all we are explaining with this YouTube channel. So today I would like to say about a latest ISO standard which is ISO 7101 Healthcare Quality Management System. This is the latest ISO standard, one of the most advanced quality management systems in the world. In this healthcare sector, if you look at it, you can see there are two important standards. One is that JCI Gold Seal. JCI, like a joint commission international's accreditation, which is focusing to patient safety, and another one, our ISO 9001 quality management system. So if you look at the JCI, which actually published in 1st January 2021, now we are in December 2023, it is getting 3 years, and our another relevant standard is our ISO 9001 2015 version, which is going to get around 9 years. So during this time, the context changed already. Context changing rapidly. So the entire world is progressing. So there is a necessity to review these standards and to verify its relevance and what are the changes we have to incorporate into the system. That is a necessity now, and that one actually ISO addressing, and ISO noticed there are 6 major challenges while this change in the context. The first one is rising healthcare cost. It's very expensive and the ordinary people cannot afford it. So that kind of way the expenses day by day increasing. Another point is regulatory compliance. The number of regulations like international, national and the local, that kind of way, lot of regulations are applied, especially the COVID-19 scenario. We have seen like the entire world was struggling to manage the people to prevent the COVID and for the recovery. So that time lot of regulatory requirements actually came in place. And another point, like a patient satisfaction, that is became the utmost priority. Patient survival and their well-being and their health status to improve. So these all it's actually the challenges. And another one is the workforce shortage. You know that a pandemic time we lost a lot of health workers, doctors, nurses. In fact, their dedication, their commitment, that in fact it's like a sacrifice to the human race. Human race always must be always remember this their sacrifice for the healthcare and the survival and the well-being all. So we are indebted to those people lost their lives during the COVID-19 pandemic. Then this sector, in fact, like some people, the healthcare workers, doctors and nurses, they express their concern about their own survival and safety. So that also to be addressed, and this total this kind of scarcity, shortage of the ratio with the doctor to the patients, the number of nurses to the patients, that also now it is expanding. And this finally the technology adoption nowadays, like you see, artificial intelligence made a breakthrough in this 2023. Artificial intelligence standard is being published, that is in the final stage, and that will make a revolution in a rapid way. In fact, that is the tool of the Revolution 4.0, which already started in 2011 in Germany, but the rest of the world slowly adopting, but now it has been very rapid after 12 years. So that we have to see the entire healthcare system is going to be revived with the Revolution 4.0 tools. Then you can see more application of the artificial intelligence, computer robotics, Internet of Things, and data analytics. These all Revolution 4.0 tools are incorporated. And one more challenge, the sixth and the final challenge is the changing demographics. Now our population reached to 8 billion. So that entire world has to understand. And aging population day by day increasing. So the needs and expectations of the patients rising day by day. So all these 6 major challenges of the context of the world, ISO 7101 addressed, and they have developed this standard in a advanced way by addressing all these challenges and making the solution. And that solution is actually this standard of ISO 7101 healthcare quality management system. This standard is actually aligned with the 5 goals of United Nations SDG, Sustainable Development Goals, 17 goals. Among the 17 goals, this standard is aligned towards 5 goals. So that much over and what is called highly influential, this standard, and highly there will be acceptance also for this standard worldwide, because ISO take over the healthcare now. Earlier, JCI just given only 22,000 standards, the gold seal in around 100 countries, but ISO issued ISO 9001 quality management system standard around 200 countries in the world, like double. So more acceptance, recognition in the countries for the ISO standard, and it already awarded to around 2.2 million organizations worldwide. So around 2 million certificates, more than JCI ISO already awarded. So that point of view, now this standard is more advanced. My point of view, like in a summary of this standard, like ISO 9001 QMS plus JCI Gold Seal accreditation equal to ISO 7101. That kind of way it has been enhanced and it has been expanded. So what is healthcare? What is the definition of the healthcare? Organized provisions of services to individual or a community in order to address, manage and improve their physical, mental and social well-being. That is the definition of the healthcare. So what is well-being? That is the optimum level of this physical, mental and social, the health status. That is actually this well-being. So that kind of way, this standard is actually doing three things. It is addressing the patients, and it is managing the patients and improving their the health status. So that is the way this standard has been evolved, and this standard has around 7 aims. In fact, this standard to create a quality culture with a strong leadership. So now it's a leadership version. This one is a leadership version. It's not a management driven version. It is a leadership driven version. That's why if you look at the structure, the framework, you can see LPDSA. L is the leadership at the center, which is the major clause number 5. Then PDSA like surrounding to that one from clause number 6 to 10. So that is the way leadership first. Leadership take over the entire accountability of this management system. So you see, leadership has full authority power. They can take a decision and they can give the commands and instruction. So you can see the advantages of the leadership if they really realize the relevance and importance of this healthcare. Then you see their action will be more powerful action, and management and other people all follow their instructions and commands. So that kind of way standard has been very powerful and effective and efficient because of this version is a leadership version. For example, one organization, one healthcare organization has 100 doctors, and there are 90 departments and 90 doctors working in 90 departments, and like 10 doctors working in emergency. Emergency situation happened, a tragedy happened, and 100 patients were admitted in ICU. There is no place for the care, and 10 doctors only there, and they able to take care 10 patients with proper care and infrastructure and facilities, and they survived like 10 people's patients' lives, but the 90 patients' life we lost. Such a kind of scenario, even the COVID-19 situation, this one was a reality also. So such kind of situation happening, the leadership now take over. Leadership will make changes. Leadership can anticipate. Leadership can visualize for a better vision, like a zero fatality, and that kind of way, in order to achieve that target, risk-free situation, what we have to do. So leadership decide, like all the departments, we construct and provide resources and facilities for a ICU in each and every department. That department doctor can manage. Just an example only. I am not expert, but I just say one example. And that kind of scenario, like an emergency situation happened, 100 patients were admitted, a siren, like a alert alarm, is given to the entire hospital, and like 10 people can be accommodated their emergency, then the other 90 in all the departments. So they are also graduates, they are also capable, they also will have capability. Even the ICU cross-functional training can be given, then directly to their unit, directly to their departments. These patients will be admitted, and they can smoothly can manage, and they can able to survive these 90 more patients. So what is happening? We get 100% people survival, the patient survival, and that is actually a leadership decision. Like leadership anticipate and visualize for a zero fatality, and leadership provide all the resources and infrastructure and facilities, so that way we can manage. So that all will happen because of leadership taken over the accountability of the PDSA now. Then people centered care, respect, compassion, co-production, equity, dignity. This version giving lot of virtues, like lot of result. This version can create, and this one is a risk management version, like severity, occurrence, and detectability. Detectability factor also very critical. We can use the failure mode effect and analysis. There are so many YouTube videos. You can be expertised in risk management, so you can mitigate the risk in a like a safer zone. That way you can manage. Then this version is ensuring patient and workforce safety and well-being. Last versions are mostly patient focused. Then COVID-19 taught us workforce, our own doctors and nurses, they dedicated their lives as sacrifice to COVID-19 we have seen. So we have to take care not only the patients, the entire workforce, entire doctors and nurses and other healthcare employees, all we have to take care. Then this version is importance to documented information and records. So QA QC making more assurance and more control to this version, and a performance evaluation in 3 layer, same as in the QMS, like the first layer like checklist, above that internal audit, above that management review. 3 layer of performance evaluation will make this standard more effective, and this standard is standing for continual improvement. You see, this standard itself a revolution from JCI accreditation and also ISO QMS. So this version is actually it already has a constant strategy of continual improvement. This standard actually using the high level structure. So all the ISO QMS practitioners worldwide, they can easily adopt this standard because it's the same HLS, same high level structure, same major clauses is using, and the content has some difference because it's adding values like customer focus is there, like a service user focus, that means the patient focused system, and IMS information management system incorporated already. Then contingency planning has been established. Waste management is addressed. Environment management addressed. Then people-centered care and compassionate care. This is a added value to the system. Then workforce well-being. The COVID-19 scenario we have seen, so now workforce well-being also we have to take care. Then ethics has been included. Then patient safety, prevention of the infection. In fact, I lost my mother due to COVID-19 in 2020. When she was admitted, she was not affected by COVID, but it's actually it was an infection that hospital didn't care, that hospital doesn't have the system to prevent the infection. So this requirement, it definitely will be added value to the healthcare organizations worldwide. So they can perform better way. They can prevent infections, and they can anticipate what are the risks going to happen in advance, and this is like a risk management culture. And additionally, This standard is giving a lot of we can say more than values, it's like a virtues. In fact, earlier we thought that some points, some concept, even Harvard University can't teach you. There is a bestseller, there is a book also, what Harvard University can't teach you. And now this standard, the first time an ISO standard is addressing and understanding these values and virtues which is most suitable for the benefit and advantages and also for the better result of the patients. That's why they incorporated the kindness, ethics, fairness, justice, listening, hearing the people's voice, and a culture, a risk culture, a risk attitude to prevent the risk and to save the people. That kind of a presence of mind-based attitude, that all incorporated in this version. So this version, in fact, definitely will be helpful and useful, and this version has finally another advantage, like it is audited by the latest ISO standard for auditing, ISO 19011 and 2018. In that one, the objective evidence, that is the existing, the realistic evidence is taking. Earlier versions only taking the document review and interview the people only. But this version more deeply going into the reality, touching on to the ground deeply in a three-dimensional way. This is existing realistic evidence. That definitely will add to the healthcare system, which is already in a evidence-based approach they are using. So this definitely will add value. So there will be third-party audit professionals, even though they are not doctors. ISO giving them a provision, like they can use the technical expert. Technical expert will be a doctor in your organization. So that kind of way they can conduct and they can manage audit easily by using the technical expert who is impartial to that operation or surgery, but he is an expert. He may be a doctor or expert in that area. He can provide all the knowledge information to the auditor. Auditor can manage audit and successfully can do. For example, doctors using the jargons, the long medical terminology they are using. If an auditor asking a question, what is the sickness of this patient? For example, doctor can say yeah, he got a pneumono ultra microscopic silica volcanoconiosis. But auditor can verify with technical expert. So technical expert will say this disease will happen only the places where the earthquake happening, places like Indonesia, and where the silica content in the air they are breathing, and they will have some sort of pneumonia. That is the disease. It will not happen in this particular country where the volcanoes are not there. So that way this auditor can verify with the help of the technical expert, and ISO using this intelligent way to manage the audit. So totality, this is more intellectual standard because it's using leadership and the management capabilities. That's why I say it is L PDSA. And the QMS using the PDCA, its elements are not missing. Still those elements of 3 layer of checking is there. Checking like checklists are there, quality checklist, above that internal audit, above that management review. So in fact, in my point of view, it's like a PDC essay, like a doctor diagnose and give a medicine to a patient, and after some time he's monitor, measure, and he's checking with the checklist what is happening. And he going to the study, he understands that there is no improvement, but the things are getting worse. So when he study the thing, he understand the medicine what he prescribe is not effective, so another medicine he can prescribe, or sometimes the dose is not enough, so he can give additional dose. So that kind of way, this has been something like not losing the PDCA concept, in fact adding value with the study. So it has been PDCSA, in another way, leadership taken over the total accountability, authority and decision making. Then surrounding to that PDCSA is rotating. That kind of way, definitely this has been more intellectual and more intelligent standard, and this is today's requirement, this is today's necessity for a that kind of standard, and this standard definitely will make a difference in entire healthcare organizations, the medical colleges, hospitals, clinics, and entire organizations, those providing the Medicare, healthcare, the patient-focused management system. So definitely this it is like a combination of patient safety and quality and additional more values and virtues of this only unique way designed in only this standard, this ISO standard, the first time adding this kind of values and virtues, so that advantages also the patients will get it. So definitely this standard is one of the best standards of the world, and all the healthcare leadership, top management has to think about it and take your right decisions to go for this standard and its certification. All the best. Thank you.